Well, you guys, this has been really a terrific discussion. We've touched on an awful lot of things over the last hour and a half or so. So Eric, you get to be first and just maybe give us a quick summary of what we've talked about and just basically where you think we are with HIV treatment.
Sure. I mean, I think we're in an amazing place in the field, and it allows us to, express a lot of optimism for our patients and really encourage people to want to get diagnosed and to get into care. And hopefully reassure them that in most parts of the United States that they'll have access to the best treatments available, and that the best treatments available are, I always say to patients, anything good you've heard about the advances in HIV, it's better. And it really is. I mean, I don't think anyone would have ever dreamed we would be talking about one small pill a day with no side effects that will suppress the viral load forever. And on top of that, not allow you to transmit to your partner. Sure. It's fantastic, but we still have a lot of hurdles to overcome. We still have this cascade issue where there are so many of the patients who are not in care, and I think those have become the higher priorities in research, targeting new prevention strategies and trying to link and retain that high-risk population into care.
Colleen?
Yeah, so I think what you were just finishing up with is remembering the stark disparities that we have globally, but even in the U.S. With respect to HIV treatment and prevention, and that marginalized populations, either gender minorities and sexual minorities and racial minorities, folks who live in poverty, all are not seeing these amazing advances to the same degree that other people are. And so that's where we need to be focusing our efforts, renewing our commitment to ending the epidemic. Great. Absolutely.
Dan, the last word.
I think in a field that's evolved so much since we first recognized AIDS as an epidemic viral infection in 1981, it's remarkable how much continued progress we're still making. And I think people need to keep abreast of the changes in therapy and the continued improvements in therapy, and to continue to encourage their patients to stick with it, because we are going to be able to keep all these people alive for a natural lifespan as long as they remain engaged in care. And we need to do a much better job of reaching out to the people who are not in care and making sure that they get into care and on treatment.
Great. Well, on behalf of our panel, I'd like to thank you all for joining us, and thanks again.